Hi, I'm Dr. Raphael Darvish with Skinpeckable Dermatology and Cosmetic Laser Center here in Los Angeles, California. Today I'm going to be speaking with you about how to remove spider veins from the legs. So spider veins are those reddish, bluish, thin veins that you can see on the legs. They're differentiated from the reticular, which are the kind of deeper, larger, flat blue veins, and differentiated from varicose veins, which are the kind of bulging, rope-like veins that you'll see on some women. Spider veins on the legs are removed one of two ways mainly. The first way being sclerotherapy, which is the injection of a sclerosant or a scarring solution to eliminate that vein. So the way we go about injecting those sclerosants, we start from a top-down approach, treat the top of the leg and work our way down. We can use one of a few different kinds of sclerosants available to us. Polydocanol is probably the most popular of sclerosants used in the United States. Secondly, sotradecol. And thirdly, saline. Saline really isn't used so much anymore by the younger generation of physicians. Older physicians were trained in saline sclerotherapy, but the side effect profile of polydocanol and sotradecol is better. And so most physicians are using those two sclerosants these days. Aside from sclerotherapy, there is laser treatment of the spider veins on the legs. Most often we use the 1064 nanometer Nd:YAG laser, though you can most definitely use a V-beam, which is a pulsed dye laser, or an IPL laser to treat those veins. And generally what we do when we treat veins on the legs is we draw some lines using a white liner pencil to make sure that we get every single area that has the spider veins. So we make sure that we treat an area, and when we're done treating that area, we put a check mark in that little box or circle that we drew around the area to make sure that in fact it was treated and wasn't skipped. Because sometimes in a situation where somebody has a lot of veins, you can get disoriented and lost as to really what you treated and what you haven't treated. So a good endpoint generally is going to be either the vein gone or the vein slightly darker. With laser vein removal treatments, you will generally do 5 treatments spaced out a month apart. And the treatment endpoint at each time, again, will be gone, the vein gone or slightly darker with an associated swelling of the skin surrounding that particular vein, swelling and a pinkness to that skin. Now, why choose sclerotherapy versus laser vein removal treatment? Generally, the end result is pretty equivalent, meaning they're both very effective. Some patients prefer the laser vein removal treatment because there's no needles involved. Some prefer sclerotherapy because they've done it before and they know it works and they're happy with it. And for many, many years, it was considered the gold standard in therapy for spider veins on the legs. I'm Dr. Raphael Darvish, and that's a brief overview of how to remove spider veins on the legs. Thank you.